for 2 reasons.
What's that?
I have deviated septum from a rollover accident.
Okay.
And I was told when I was younger that I have scoliosis.
You were told when you were younger you had or have scoliosis.
Mm-hmm.
Okay. How old were you when you were told that?
Junior high, 8th
Junior
grade.
high, 8th grade. Bend over, touch
Yeah.
your toes. There's a curvature. Must be that. But when was the accident?
It was in 2006.
Okay, 2006. Tell me about the accident.
It was a rollover car vehicle accident. It was like an overcorrection, and the car just,
Rolled.
yeah.
And the only thing that happened was your nose, you're telling me?
No, I believe I passed out, and they pulled me out of the car, and it was obviously turned over. They thought it was broken.
Okay.
The year before, I had deviated septum surgery, so I had just had it fixed.
And it was fixed?
Yeah. Mm-hmm.
Okay.
I was able to breathe.
Let's rewind then and go there. So
Mhm.
you had deviated septum surgery when? 2005?
2005.
2005.
Mhm.
Was it cosmetic or it was affecting your breathing?
Oh, it was totally affecting the breathing since I was young, 16.
Okay. Well, let's rewind and go to 16. What happened at 16?
Well, since I was little, I always had breathing problems.
Okay.
And my mom finally took me to an ENT specialist, and he told my mom that for sure I was going to need surgery because the bone was covering a whole side of my nostril and I wasn't getting any air.
The septum or the nasal bone?
The nasal.
The bone itself?
Yeah, inside. Mhm.
Okay. So they didn't do septum surgery, they did the nasal bone.
Possibly. He really didn't explain, but all I know is like when he finally did it, when I was 20 something years old, I like was able to breathe 100 times better. I didn't know what it was to breathe.
Okay.
So then I get into the accident, and it was like back to square one, with the whole breathing thing.
So after the accident, the breathing was the same as before?
Yeah.
Difficulty?
Yeah.
And they did x-rays, nothing was
Yeah.
broken?
Yeah, they said that it was going to need time to heal so they could really see, how it was left. And
Okay. Did you go back?
yeah, but not right away. I think due to insurance purposes, they were just like, well, actually one of them said it looked like it got pushed down, the ENT. And he said I would probably need to go to a plastic surgeon, but that for sure,
Is it a cosmetic thing for you, or is it I need to be able to breathe?
For me, I need to be able to breathe.
Okay.
Because
So,
I've been on nasal spray for like 2 years.
okay, what else besides nasal spray do you have to do to help the breathing?
The nose rinses.
The neti potties?
With the saline wash.
So 14 years
Mhm.
you're using nasal spray.
The allergy shots, they didn't really work, and then the nasal sprays. Yeah.
Allergy shots for what?
They just thought I had allergies.
From the accident?
No, that was just like,
Going back now 16 years ago.
yeah, that was just in between. Like, they had me on different stuff according to what my insurance would cover.
All right, let me rewind one more time. It's not you, I'm just what you've gone through.
Yeah.
I'm picking it up a lot, by
Okay.
the way.
Okay.
So, we're good. We're
Okay.
good. You're okay.
If it's hurting because I slept too long, I notice right after I'm getting ready for work and I'm standing, I notice if I'm standing, I can't bend. Like I can't bend
Forward.
down. Like I can't bend down. Like it's hard
Bend
for me.
down, mean you can't bend your knees to
Yeah.
go down?
Yeah.
So just
like,
so I'm clear, I won't have you do it right now. You can't bend down like this,
Yeah.
or you can't do this.
that and the other.
Okay, and it hurts you where? Low back?
Lower back.
Okay. Okay.
But I notice like if I force myself, because I used to go for jogs and walks in the morning for my high cholesterol, I noticed that although I felt very, very stiff, that's actually what would loosen it up. So it was a positive.
The walking.
Yeah.
And we know, right, the body heals with motion.
Which I was surprised
Why?
because I
No
figured
one told you
it
to
was
move?
no one's ever said that's what helps it.
Okay, hold on. Let's give some information. To move, movement is life. To animate, you've heard of animated objects, animation or inanimate. Movement is life. Without that movement, there is no life. And whether it's in the human body, in the whole person, and even in the individual joint. The way these joints get nourishment and hydration is through movement. And there's a process, just like our knuckles, our knees, our ankles, our spine. Through the movement, there's a process called imbibition. And that imbibition means to imbibe those fluids and nutrients in and get rid of waste products. It happens most efficiently through movement. We also know, according to the research, 90% of the nutrition to the brain comes from movement in the spine. If we have loss of, or lack of motion, lack of movement in the spine, we get less nutrition to our brain. It's kind of important. Oh, you're here for scoliosis, back pain, and deviated septum that's affecting your breathing. How's the sleep? Are you able to sleep through the night, or are you waking up because of this?
It wakes me up.
Every night?
Yeah, I mean, it'll eventually like stiffen up and I'll go to the couch. The couch is way more comfortable for the positioning, I guess. I don't know.
And the stiffness is in the low back, not in the neck,
No.
not in the mid back. How's your digestion?
Not bad.
Okay, let me qualify that. When I say how is digestion, meaning, and it's not just I go to the bathroom every day. We're going to qualify a couple of things. Should be smooth, should be a darker color, and it should sink to the bottom. It's a very important question I'm asking, because that one question tells us a lot about the person's digestion and how they're processing their foods. Dark should be darker, and it should sink to the bottom. If it's lighter, and if it's dependent on the meals that you eat, I have a feeling it changes color with you.
Oh yeah.
And it's based on what you eat and when you're eating. Yeah? So it can go from dark sinking, it can get lighter and get a little floaty as well. Does that make sense?
Yeah.
How do I see that in your spine?
Yeah,
Okay.
you're getting too personal now.
I am. That's why you're here, right?
Yes.
That's why you're here.
Yes, we need to know.
Why are you here? Why are you
I wanted to
here?
get fixed.
Because you drove a long way.
Yes.
It's 7 hours, right? It's a good
No, it's
6.
just 4. It's 4.
Oh, that's not bad.
No, it's not.
Oh, then you're further south.
And it helps when you go 80 now.
Okay, so we're gonna watch you walk. Okay, we want to evaluate your gait. I want to see kind of how you're moving. And after we evaluate your gait, I'll point out some things. We're gonna go to your x-ray, we're gonna do the analysis. We're gonna see if this is really a scoliosis or not. And we're gonna determine, are these things that we can fix, okay? Or are these things that need to be managed? Two different things. Now, there are other reasons why you're here that I'm gonna go over on your films, okay? And now, I have one visit with you. We're gonna need to schedule a follow-up. Is that okay?
Yeah.
I know it's a drive, but it'll be okay. All right?
Yes.
Shall we?
Yes.
Let's get started. We need to evaluate your gait, and let's just get a look at overall appearance as to what's going on. I want you to focus over here first on the sacrum. I don't see the dimples, and I see that this side is a lot more swollen on the right side here, okay, compared to the left. Then you can see the spine goes like this, curves a little bit to the left, goes to the right. So there is curvature issue, but the question is this scoliosis? And is this from birth, or is this because there was some fall or trauma and the body starts compensating? And we're going to evaluate your x-rays to determine what this is as well, okay? All right, let's tuck the back of the gown in. Go ahead, and I'd like you to walk a straight line, please. Look straight ahead and just regular walking back and forth. Turn around right there. You don't have to cross over. There you go. And this is your normal walk, right? Okay. So we can see you're coming from up north Fresno area.
Yeah.
So we got this NorCal wiggle going on here, okay? We got the left wiggle. So when she walks, instead of the pelvis moving like this, watch, boom. It goes like that.
I can't see that unless I'm seeing that. I'm like,
You'll see
I
it.
feel like I don't match my top half.
You don't match, what do you mean you don't match your top half?
Yeah, I feel like my body's going straight upper half, but my lower is like going like this.
Interesting, okay.
And I only saw it because I saw it in a mirror.
Interesting.
And I'm like, why am I moving like that?
Yeah, so we have side shifting of the pelvis. Walk a straight line, please. Turn around. Okay, and you can kind of see, I just want you guys to notice, I want us to notice kind of this walk. And this is your normal walk. Walk on your toes for me, please. Okay. And you can see the wiggle a little more pronounced that way. Walk on your heels, please. Is there any pain with this?
Maybe on this side. Maybe.
Not in your low back though, right?
No.
Okay, you can see the wiggle both ways, okay, when you're on your toes and on your heels. Okay, regular walking, please. Back and forth. And now, I want to test this out. Stand right over here, please. And I'd like you to march in place. Eyes open. And then I'm going to have you close your eyes, and we're going to see if there's a shift. Close your eyes. Okay. Now, as soon as she's doing that, I'm not moving, but we can kind of see, knees up high. She's thinking too much. When she stops thinking about it, the real issue is apparent. Are your eyes closed?
Mm-hmm.
Open your eyes. Check out where you are compared to my hand. This is where you started.
Oh.
So there is a foundation issue and an upper cervical issue. The body's a little bit off balance. So this is a picture in time. This tells us how you've evolved over the years. Let's go ahead and start this analysis and figure out what's going on here, okay? Now, this is looking at you from behind. This is right, this is left. We have 24 bones in the spine, 7 in the neck called cervicals, 12 in the mid-back called thoracics, 5 in the low back called lumbar. So C1 through 7, T1 through 12, L1 through L5. And then we have the foundation of this 24-story building, which is the sacrum and the pelvis. And this work is all based on what? It's called the level foundation principle. And the level foundation principle, in order to have a stable building, we need to have a level base and foundation. Okay? Now, we're going to evaluate that in a second. I want to go to this x-ray and explain a few things before I do that. This is the side profile. Looking at you from the side, this is what I need us to see, okay? We are designed to have 60-degree reciprocating curves. 60, 60, 60. That's 180, we're upright. Okay? That's number one. Number two, I want to do the posture assessment. And the posture, have you ever had this done anywhere where they said, look at your posture with a weighted string, a plumb line they call it? Does that sound familiar?
No, but they did say I was uneven.
Okay, but they didn't do a side profile. Okay, so the side profile is this. Is they take a weighted string, the ear should line up with the shoulder, the hip, the knee, and the ankle. Now on the x-ray, we take the lowest lumbar vertebrae, and before I cross here at the lowest lumbar, I just want you to note the whitening going on here. I'm going to explain what that is. You see that extra whitening? This is the disc. It's very different, right? It's open here. There's a little lucency there, and then it's getting wider, almost like it's fusing in the back, calcifying. Okay, I'm going to explain all that. But do you see that before I mark it up? Okay. So we take the lowest lumbar vertebrae. We're going to run a laser level through, and it should go through. It should go through C7 and C2. Okay. So I'm going to match it up here first. All right. So we're level right there. Okay. Do you see where your C7 and C2 are? Look, C7 is there, you're here. C2 is there. So there's what I want you to see. You have the anterior head carriage going on in the neck, and it's due to whatever's going on down here. Okay, now let's go a little bit deeper with that. If we look here, this is where the spine sits over, the upper body sits over the foundation. Now, if I take this angle of your neck, okay, and I'm not using this right now, I'm just showing you just with this. this angle, so this is where it should be neutral, right?
Mhm.
If we take it from here, I'm drawing a lot of lines. Let me do this. This angle is probably about 12, 15 degrees. What the research shows, for every 1 degree forward from neutral, it's like carrying an extra 10 pounds on the lower cervical spine. Now, what I want you to see here is this. So this alone, if it was lined up, would be about 120 to 150 pounds you're carrying on your shoulder. But when everything is forward that way, let's take it from back here. And let's look at this angle now. What's this angle now? It's a good 30, almost double. So that's like what? 30 times 10 is 300 pounds. You think you have some tension in your shoulders, lady?
Yeah.
A little bit, right?
They've had to do the shocks before right there.
Okay, but I'm explaining to you mechanically why it's happening. Does that make sense? Now, that's the main thing I wanted to show you here before we come back to this. Let's go back to this x-ray. And what you want to know is, do you actually have a true scoliosis, or is it curvature due to something else? Now, in the evaluation, and I've been doing this quite some time, what I'm looking at is I'm measuring sacrum S1 with the dens of C2. When the dens of C2 lines up with C1 on this film, that kind of tells me that the body is already compensated. I'm probably not going to get any correction in the appearance. But I also want to be clear, my job is not to straighten your spine. My job is, number one, to evaluate and stabilize your foundation. My job is to help you find your balance and to make sure we have the right curves on this x-ray. As long as we have these curves, the reciprocating curves, that's our first line of defense. I have a video called Dr. Rahim Chiropractic 101. It's the least viewed, but it has the most knowledge, okay? And I go through a lot of the general information of what we call spinal defense mechanisms. The first line of defense is our spinal curve on this film. If we don't have it here, whatever's going on here, you feel more. If we help get these curves reestablished, whatever this appearance is, it is what it is. Now, but let's see what it is first. My mom always said, age gracefully. Getting old sucks. All right, so we're level. Do you see how we're not lined up with the dens of C2?
Yeah.
And we're off significantly. In your case, this is actually good news. Because if it lined up, I just said, there's nothing that's going to change. It doesn't line up. So there is a good possibility, if you decide whether here or any office, go through this process, you're going to get some correction. Okay? Now, does that make sense? Okay. Next thing we need to do is go over what we call the level foundation principle. We're starting here. Now, here's another interesting thing I need you to see. This is level, okay? We may have a slight deviation. Watch this. Maybe. Okay? So maybe we got like a 2 millimeter difference on this side. Anything under 7, adjustments will hold, okay? I'm not worried about that. Actual difference with correction of the pelvis is going to be 0.4. So 0.4. Okay? So I'm not worried about this misalignment in your pelvis. Here's why. You ready? Okay. The sacrum is what's bent that's causing all this. You had an injury. This is not, I was born with this, and I'll tell you why I know this. Let's go over here to this x-ray. Let's look. You should have the sacrum regardless. It should be a smooth arc, okay? You got all these, check this out. You had a nice fall there. You had a nice fall there, and that's okay. You had a nice fall there, S2, S3, and S4. See these knobs here? This should be a smooth arc.
Wow.
That's what I see. Now, you got to watch this closely. Well, we got a couple of injuries here. These old traumas could be old childhood injuries, but your L5 is at least 20 years old.
My accident.
Okay, at least around that
That
time.
was.
Okay, now, but these three things didn't happen together. That's what I'm trying to explain. And the fact that we're getting all this whitening here, L5 in the back, or calcification, or what we call enuberation. There's a lot of good news here too, by the way. I just have, this is what I do, right? So you're putting a lot of load on the low back, and then you're having to compensate and hunch forward to give you relief. That's why you're walking with your head down, lady. And we got all this pressure up top on the shoulders because of the neck. So these are the two issues why your walk is the way it is. Can I continue?
Yeah.
Okay. Now, here's what I need you to see. Follow me, please, here. This is the sacrum. It does this, it does this, and it does this. It goes like this. It bends like this. Your bend is in your tailbone, ma'am. This is where it started. Okay, that's number one. Number two, you see the space here and here. I'm going to outline it. This is the transverse. You see the space? It's smaller on this side, right? Because that disc is wearing out. And it's wedged on your right side. Now watch, let's continue. So we have our level, first one to come off, 5. But here's what's interesting. Look, the level base of your sacrum is off. Now, we used to list inferior sacrums in the Gonstead work, okay? And it's in the Gonstead chapters. We used to list the inferior component. They stopped listing it, and I don't want to get into all that right now, but what I'm seeing here is we have a bent sacrum, or we have an old injury, S3, S4, that has developed a lot of tension there, okay? And this is what's causing this. Then we had the injury, the second one, that continued the process. Now, let's go over this process. So it's very subtle. It's wedged on the right. Do you see that? Okay, so from there, 4 goes with it, 3 goes with it, 2 comes back to level, yes? Next one to go off is L1. 12 goes with it, 11, 10 comes back. 9 is the next one off. 8 goes with it, 7 goes with it, 6, 5, 4, 3, 2, 1, 7. Your whole upper body here is coming from your mid-back, lady. Okay? T9, L1, 5L, something low in the sacrum, left pelvis. And the digestion control starts there. The reason I mentioned digestion, if I'm going too fast or you need to ask, I'll stop.
No.
You with me? Okay. You got this little circle here. You see that? That circle should be this big and dark. Called a Blvd. That's the fancy word. Blvd. Okay? Gastric air bubble. When I don't see a good size Meg, I see this small little thing, number 1. Number 2, I see gas and undigested food here. Ascending colon, transverse, descending. Okay? You're not absorbing and assimilating your foods the way you could be. And it doesn't matter whether you're eating all that good organic farm to table food. It doesn't work, does it?
No.
Okay. Well, it's going to hopefully start today.
Yay.
All right. You got a good poker face, even with the mask on. Okay. I'm just going over what I see, ma'am. Okay. Questions? Okay. Can I give you lots of good news now?
Yeah.
Okay. Let's go over the good news. So let's go over your discs. L5 we said is less, but your 4 is fantastic. 3
Mm.
is great, 2 is great, but look what's happening here. This is another finding I've seen, okay? I don't know if other doctors have seen this. You're starting to get calcification. You see these little white dots in the disc. Now the question is, why is that happening? I see a lot of those issues with digestion issues, okay? That's why I'm going back to digestion. And if we don't work on digestion, one of the greatest concerns, especially with women, as they're as we're all aging and getting older, if we don't get digestion, you need, this is, if I did blood labs on you and all that, you would have what's called hypochlorhydria, which is low stomach acid. You get a lot of this bloating feel. Is that correct?
Yeah.
Okay. Now, to get calcium, iron, and B12 out of the foods that we eat, you need to have stomach acid. If we don't have it, we're not getting it out of the foods. Make sense?
Yeah.
And it leads to low bone density a lot in women. Gonstead said this: if you're seeing low bone density on an x-ray, especially in a female, you probably have a digestion issue. And one of the reason you're here, I'm going to be straight up, is we have to sort out your foundation and your digestion. That's why I see you here. Okay? Can I continue? Okay. Do you understand what I went over here?
Yeah.
So it should be here, right?
Yeah.
Where the line is. Okay? It kings from there. 9 is coming from 1 is coming from 5, 5 is coming from 7 and pelvis. So we need to find on you what exactly where we're going to start today. That's why I said I asked for typically, just so everybody knows too, I ask for 3 or 4 visits with every new patient. That's not a lot to ask for, and I usually spread it out over a week, okay? Or if they're coming from out of town, right now obviously they're not flying in because there's no travel time, there's no traveling, but I like that timing with the patient, okay? And that's how you know how you're gonna respond. Okay? Shall I continue? So we have good discs, great discs, good discs, great discs. All through these discs are good, okay? When we get here, yeah, you had some traumas, but your disc held up well, even with that roll you're talking about. Okay? Your discs are still good. Now, 2, 3, 4, 5. We may have an issue at C5. 3, 4, 5 keeps the diaphragm alive. You ever heard me say that? 3, C3, C4, C5 is the phrenic nerve. 3, 4, 5 keeps the diaphragm alive. That's the phrenic nerve. The diaphragm is for what? In. Exhale. Diaphragm loosens, right? That's negative pressure. So the diaphragm is not contract. It contracts to pull the muscles down to inhale. Then when we push it out, it's a negative reflex, right? So it does it by itself based on how much you inspire. Okay? Questions on this? Shall we get started?
Yeah.
No, you had a question.
So, if I was born with braces on my legs, could that have affected anything?
What do you mean you weren't born with braces?
I mean, well, yeah, but
Tell me.
for the first year, apparently my mom said she had to put braces on my legs when I was a baby, and then I had to wear my shoes backwards because I was born with my legs.
You were pigeon-toed?
Yeah.
Did she drop you?
Probably. Put that on camera. No.
Listen. So bilateral toe in, pigeon-toed. And you were asking me that they put braces on, right? So you had braces on your feet when you were what, 1-year-old?
Yeah.
2-year-old?
I think from a baby to 1.
When you started to walk?
Yeah.
Okay, and they did that because your toes were in.
Yeah, I guess.
And then you're telling me they had you wear
My shoes backwards.
Okay. So when we're looking at it mechanically, typically bilateral toe in, we're always thinking something in the sacrum. Okay, bilateral toe out, there's usually something going on in the upper cervical. That's in lieu of any other major traumas or conditions. So why don't we examine you and let's figure it out and get started. And let's see what we find. Now, first thing I'm getting is actually that C5, 15 points on the left. Okay. Yeah. About 13 to 15 points. 11. Upper is okay. Let's start at the base and work our way down. Now, I showed you what I showed you on the film, right? There are times when things have been long-standing compensations can also become a problem. Okay, in your case, yes, we're getting it. 6 is not the issue. It's starting here at 9. It's interesting that your stuff is matching with your x-ray. And if it didn't match with the x-ray, what Dr. Gonstead used to say is always go with what the patient presents with. So if there's a discrepancy between the patient and the x-ray, check your exam and always go with the patient to give them the best result. Okay? And there it is, ma'am, down low. S3, S4, T9, C5. Those are the 3 majors I'm finding today. Okay. Now scoot forward, please. I'm checking the movement in the SI joints. Open wide, please. And close. Open and close. Open and close. Good. Are you okay doing that? Okay, do the right side only. When she does the right, the left wants to go with it. Do the left side only. When she does the left, the right is fine. So we have a left pelvis issue. Scoot back for me, please. Okay, now let's check your low back, L5. Back slowly towards me, please. That's your 5. Pain? But we have to go down. S1, tender.
Yep.
S2, tender. S3, which is the worst or the most? S3 or S2?
3.
3, that's where it's starting. Okay, let's go one more. S4, not as bad. S3,
Yeah.
now you're holding it in, I can feel it. S3, let's go ahead, head down please. Now obviously I'm wearing gloves and the static palpation requires a little more. I'm looking at the edema. Well, I would like to share one thing in this static palpation and what we did in school to practice. How do we feel this stuff? We have all these different things that we were taught in school. So one of my mentors said, get a bag of bones. They sell individual bones in a bag, okay? They sell individual bones in a bag. And so she said, keep one bone in your pocket and just feel it. Just leave it in your pocket the whole week in school because every bone has different characteristics on it. The transverses, the spinuses, the laminas, the vertebral bodies, the articular pillars, everything is slightly different. So that was one thing. The second thing is we took a phone book. This is good information for you too. And we would take a piece of hair, partner up, and person closes their eyes, the other person will put the piece of hair in between 2 pages. And then the other person would feel where is it. And then you keep going and see how many pages you can get through.
Wow. How many pages did you?
At the time, I got through half the phone.
Wow.
Yeah. Watch this, guys. Right there, you can see the changes and the swelling. Whether I feel it or not, it's very visible. And it goes, look, all the way to that side. Right there. Okay. Duele? Pain?
Yeah.
More here, more here.
That one.
How about below? Starts there. Head down, please. 7. 1, 2, 3, 4, 5, 6, 7, 8, 9. 9, S3. Let's check up top at the neck. Is this making sense, lady?
A little bit.
Huh?
Basically, I'm broken.
Basically, you have a few things that we need to put back in place,
Yes.
okay? Family knows you came down here?
Yeah.
Okay. 7, 6, That's the one there.
Mm-hmm.
Yes?
Mhm.
5. Not so bad here. Tender, but not that.
Yeah.
Left side, right side, left side. We have more muscle tension on the left.
Mhm.
I don't feel the swelling actually in C1. C5, T9, S3, left pelvis. You ready?
Mhm.
You sure?
Mm-hmm.
Let's get started. Walk it off once and we'll get started. Focus on your breathing, please. Arms up. Focus on your breath. I got you the whole way, okay?
Mhm.
I'm on S3. You just focus on your breath. 5, 1, 2, 3. Okay. Deep breath in. And I'm just prepping to see how far it's going down. Deep breath in. All the way out. As you exhale, I'm just applying pressure. Let the belly button go down with it, just like that. Beautiful. Deep breath in, all the way down. So her challenge is, we got to get that S3, but I got to torque to help get that lift, okay? If we can get some correction in that sacrum early on, then we're going to get some good changes fast. That's a piece. Deep breath in, all the way out. Good. Gotcha. 2, 3, 4, 5, 6, 9. Now 9, we got to do on the right side. Home run. Gotcha. Hi. You okay there? All right. I'm bringing it up. Hold my ankles. And let's walk. And just from that, as you're walking, walk back and forth 3-4 times. Keep your head straight when you walk, please. And you let me know from that right now, is anything different in how you're
I
feeling?
feel less tension.
Already?
Yeah.
What
Yeah, I
happened?
feel less tension. So it's, yeah, feels better.
Okay, have a seat over here, please. C5. All the way back. Okay, I got you the whole way, okay? Nice and easy there. So with C5, the idea, put your hands on your lap. Nice and easy. Breathe. Good. Nice and easy there. All the way. Good. Let me do it, please. Gotcha. Nice. Give that a second. Deep breath in. Out. Stand up and walk it off, please. And as you're walking, I want you to take, here's what I'll have you do. Walk towards us first, because you're playing too much with that thing. Turn around. You can drop the mask a little bit just to breathe.
I mean, it feels better.
I haven't touched your nose yet,
Oh my god, it's here.
and I don't know if we're going to need to do it right now. But the first thing you tell me what's different in the breathing, if anything.
Okay.
You can cover up if you need to. It's up to you.
Yeah, I mean, yeah, I can breathe a lot clear, a lot better.
I didn't touch your septum, man.
But I feel like I just feel lighter for some reason. I feel a lot lighter. Am I supposed to feel that way? I feel lighter. I just feel like 20 pounds has been lifted off of my body.
Very nice. C5 is clear. Well, the idea here is what? We're helping you get back in balance, okay? And we're trying to figure out what's out of balance. 9 is clear. Sacrum is, oh, wait for it. Clear.
Oh wow!
Now,
I feel it too.
let's-
That's crazy.
Let's palpate. Let's feel this S3.
Wow!
Come back
I
slowly.
don't feel that pain.
Come back slowly. Look. L5.
Yeah, that's so
S1.
weird. Oh my gosh.
S2.
That's so, oh my
What's
gosh.
check it out.
Oh my gosh.
Now we got
so...
the matrix action.
Yeah, I feel like I could now.
There you go. Dodge bullets.
Wow. Oh my gosh, that pain is not there.
Pretty cool, huh?
That is amazing.
And you've been dealing with that for how long?
Years. 12 years. My
Hold
son's
on.
12.
Relax there. Shh. Ears. Nice. On your back, please. Now, you should feel your hips feel more even on the table. Yes?
Yeah.
I'm going to work on your ankles. Sound is the board. AS talus. Talus. Okay, stand up and walk it off again, please. Now, as you're walking, just tell us all the good stuff and bad stuff. Just what's different.
I don't feel the lower back pain at all. That I felt I put a lot of pressure on as I would walk.
Okay.
My neck feels lighter.
Okay.
Feels great.
Pretty
I mean,
cool. Come over here. Turn around. Now, what I want to see is how do we still have the same wiggle, or do we have some movement through the SI joints? And the first thing we should see is this: the swelling is less. Okay, walk, please. Ah.
oh, I
Ah.
feel it. Oh my gosh.
So now she's getting this movement through her SI joints this way. We still got a little wiggle, but it's okay. It's one adjustment.
Yeah, I don't feel pressure on it though. That's the difference. I could feel like I could walk freely, like it's lighter.
Nice.
Yeah.
Checking the hands and the elbows. Squeeze. Got a strong grip, lady.
Mhm.
Squeeze.
He's
Elbow. Thumb. Lunate. Squeeze. Dude, she got a grip.
Mm-hmm.
Relax there. Madeira.
Yes.
So we just got rid of the Madeira wiggle.
No, the NorCal you
The
said.
NorCal wiggle. I have a little bit here, posterior lunate. Relax, please. There.
What's that?
This bone. 10 bones in the wrist.
Okay.
This is the part of, you're on the mouse?
Mhm.
A lot?
Yeah.
A lot.
Mm-hmm.
Okay. Get yourself a pad with a little
Yeah.
extension, please. Squeeze. Hard. There you go. Squeeze. Hard. Any questions?
No, no. Does it look like it needs to be?
Right now, I see a little bit of swelling in the nose. Okay, that's what I see.
So it's not deviated. You can't pop anything.
I mean, it could,
Can we?
but
Because I drove all this way.
for a nose pop.
Yeah.
Go on your back, please. There's not a lot here. This is the septum. This is the bone. I'm not on the bone. I'm on the septum. You ready? That's the bone. That's the septum. Gotcha.
Oh, wow.
Breathe. Slowly, slowly. In through the nose. And out. Come on up and walk it off, please. And as you're walking, you can tell me what's different.
Oh, wow. Oh, wow.
Oh, wow, what?
Well, the left side can never really have good air breathing on this side.
Okay.
And I feel like it's even now with this nostril.
Seriously.
Yeah. Was it more this way? Did you have to see? Thank you.
You're very welcome. All that you
But I
drove
heard it.
4 hours to pop your nose.
Yes.
But you do realize that wasn't the major issue.
No, but you know, I always knew that I had that really bad back pain. So I was like, well, let me see if he could help me with that.
Okay. You're all good, lady.
Thank you. It was so worth the drive.
Into the office.
Yes.